Well, usually on Wednesday we have our heart calls with Dr. Scott Davis, but today we wanted to change it up just a little bit in light of yesterday's announcement on Good Morning Arkansas that ABC's Robin Roberts has breast cancer. She made that announcement yesterday, and actually yesterday we were talking about early detection with our Komen story and Erin Dean and her sister who passed away from breast cancer. Here's a little bit of her announcement.
I'm very, very blessed and thankful that I found it early, and I detected it. Ironically, the day that we did the tribute show for our dear friend Joel Siegel. And I happened to do a piece on the show about his courageous battle and how early detection is key. And that very night,
I found Joel Siegel's death, and that's when she found it in a self-breast exam and then went on to the doctors. Today we have in Dr. Amanda Farrell with Baptist. She's a radiologist and the medical director of the Baptist Breast Clinic. Good to have you in today.
Thanks for having me.
We were just saying, if anything, this is a celebrity, but it helps to spark talk. It helps to bring more awareness to the problem, right?
Right. Screening is so important, and over the past several years, they've actually noticed a decrease in the number of people coming in for their screening exams after years and years of the numbers of people going up who come in for screening. So I think it's really important that we get the word out that you need to get screened. If you're over age 40, the American Cancer Society and the American College of Radiology recommends that you begin screening for everybody over age 40.
Yeah, let's talk about her age and the fact that she said she has no family history of that. Many people may say, it's not in my family, I'm not going to worry about it for a while.
Right. So many people will say, oh, I really wasn't worried because I have no family history. 80% of the breast cancer that we see is in people who have absolutely no family history.
80%? That
no
surprised
family
me.
history. Yeah, it's very high. The number of people who have genetic breast cancer is obviously around 20%. And the risk is very high if you have a genetic abnormality. But most people don't have it, but they're still at risk.
Yeah.
If you're a woman, that's a risk factor.
If you're a woman, exactly. Now, she said she found it in a self-breast exam, which is great, but then went on and the mammogram did not show anything.
Yeah, mammograms are not a perfect test. They're the best test that we have right now. They detect 85 to 90% of breast cancers, but that means that 10 to 15% are not seen. So if you do see, or if you do feel something new, it's not fully evaluated until we do an ultrasound. So it's really important that if you feel something new, a lump or a thickened area, please tell us because we will do an ultrasound.
Yeah, you had said sometimes people, they've gone through all the people that you see in the doctor's office and they don't tell them, hey, I felt something, until maybe they're almost about to leave.
Right, right. It's not uncommon for that to happen. And of course we stop everything and we keep them until we make sure we do that ultrasound and evaluate them thoroughly.
So tell them if you have felt anything, even just
anything
if it feels
new.
different.
Exactly. Thickened areas or a lump.
Yeah.
You know.
Let's talk about what to expect, because so many women are afraid of that first mammogram and the difference between that and the ultrasound.
Yeah. With a mammogram, unfortunately, there is compression. There's no way around it. So we do two views, one kind of from the side and then one from top to bottom so that we can make sure we cover the entire breast. And the compression that we use allows us to decrease the radiation dose that we use. Mammograms are very low dose in radiation right now. For ultrasound, what you do is you lie on your back on a table with your arm over your head, and we use an ultrasound transducer. It's a little square thing, and we rub over the breast, and that shows us where we're looking.
Much like you've seen pregnant women have done on their belly.
Yeah. Exactly. It's the exact same thing.
A little cold, but not uncomfortable.
Actually, we have a gel warmer.
There you go. Good.
The gel is not cold.
Of course, Dr. Scott Davis with Baptist and Dr. Farrell as well, and the Baptist Breast Clinic is a great place that you can go and get lots of information as well as have your screenings done at least by age 40, right?
Yes, ma'am.
And every year after that. Okay, 1-888-BAPTIST, of course, the Baptist Helpline, and they can, of course, send you right on to the Baptist Breast Clinic. It's just right there behind the hospital.
That's right, on Canis Road.
Okay. Doctor, thank you so much.
All right, thanks for having
this, and hopefully this news will save even more lives in the future.
We hope so. Thanks so much.
Thanks.